Welcome, everyone. I'm excited to talk about this topic. I was mentioning before, my personal interest in this is my husband is 15 years older than me. And so I have a strong investment in making sure he lives a long time. He promised me 40 years, so I'm going to try and make sure he gets that, or I get that. So let's begin. These are the reasons why we're doing this talk today. What is inflammaging and why does it matter? What are sirtuins? How have NAD, NMN, and NR been shown to help aging? What is senescence? What is the SASP? And what are my treatment options for longevity? I know we have talked about, skimmed over a lot of these subjects throughout the time, but we were doing that just knowing that this talk was coming to give us a little bit more flesh to the subject. So first, we have a little bit of biochemistry. If you all have seen this before, the cell itself has a choice. And so if you think about in order for it to take substrate to make energy, so every single cell requires energy. Typically, we make that in the form of ATP. And in order for cells to make ATP, it requires a fuel source. And so these cells choose to either use fats, carbohydrates, or proteins. There are different pathways they go through to get to that point. They can choose to use carbohydrates with or without oxygen. Using carbohydrates without oxygen is the less efficient but quicker way to obtain energy for the cell. So there are certain circumstances under which that would happen. Of course, we wouldn't want them to use protein because that typically would mean that you are breaking down muscle. Again, the efficient cell has metabolic flexibility, and plenty of NAD plus and plenty of ATP. These are your packets of energy. They have very few reactive oxygen species and plenty of antioxidants to counteract the reactive oxygen species when they do occur. The efficient cell can easily shift among glucose, fat, and protein depending on the demands of the environment for the cell. The stressed cell has either excess glucose or fat, infection, trauma, ionizing radiation. This cell, in the face of stress, will make one of several choices. Autophagy is the process where the cell takes care of itself by slowing down, making repairs. Instead of making a new protein or a new cell or dividing, it slows its functions down, sort of like when you're hungry and you stop what you're doing and go make a sandwich. For the cell, what it's doing might be producing new muscle cells or secreting hormones. And it stops this job and attempts to restore normal energy production. It takes on this stressed cell. Let's use blood sugar as a good example. We have lots of patients who have diabetes or glucose management issues. So let's take on a hyperglycemic cell as a stressor. So this hyperglycemic cell is going to upregulate the enzymes that are required for using sugar as a substrate. It will increase glycolysis, or the breakdown of glycogen back into glucose for quick use, and it will begin to take any fat and synthesize cholesterol so that you end up with lipid droplets in the cells in response to the increased sugar. This will downregulate the enzymes involved in fatty acid oxidation, which is fat burning. It will downregulate branched chain amino acid metabolism and oxidative phosphorylation, which is the production of energy in the form of NAD and ATP from fats or glucose without or with oxygen in general. This is going to create a state of increased reactive oxygen species. So when you're using glucose without oxygen, the cell begins to be stressed. It increases the number of reactive oxygen species, which is another stressor. This affects proteins around them, it affects the DNA, and the cell will burn through its ATP and NAD to accomplish it's because of the stressor. So now the cell begins to increase production rather than of NAD, it will make NADPH, which begins to go a different pathway, allowing the cell to deal with the increased reactive oxygen species. We talk about fermentation. You're probably familiar with that as far as in yeast, it makes alcohol. This is, again, the production of ATP, or packets of energy, from glucose in the absence of oxygen, and that's the difference. In response, this is a response of the cell to oxidative stress. This is anaerobic glycolysis. It's an energy shift that occurs in response to this oxidative stress. It occurs by activation of AMPK, which we'll talk about in a minute, and it's followed by this increased NADPH, as I mentioned in the previous slide, to allow for more antioxidants like superoxide dismutase, catalase, and a more familiar glutathione. In muscle, this process makes lactic acid, which we think is the cause of muscle pain, but actually the lactic acid goes right to the liver to be reprocessed. And so the reason for for delayed onset muscle soreness is actually because of the eccentric activity of the muscle. In colon cells, this process affects healthy immune cells and bacterial species in the lumen. So if your colon cell, instead of being able to use oxygen and glucose or oxygen and fat as a substrate, it now will be using glucose by itself without oxygen. The bugs in the intestine begin to take that oxygen from the cell, and we now change the bacterial species from anaerobic species to either facultative aerobic or aerobic species, such as E. coli, Klebsiella, Proteus, yeast even, or is a facultative anaerobe. And so now that colon cell is under stress because the oxygen is being taken away from it, and it begins to, rather than secreting antimicrobial peptides and fixing the water balance for the colon and the stool like it should, it begins to not be able to do those things and allow the overgrowth of the wrong kind of bacteria in the colon. Now the cell itself begins to affect inflammatory species in the body, and it can cause that gut-brain connection of inflammation. The nice thing about fermentation is it does produce, or anaerobic glycolysis, it does produce 2 NAD and 2 net ATP, and it's a rapid process. So a stressed cell has this option at its disposal. This is that process. As you see, it makes 2 net ATP, it makes 2 NAD, which are recycled to do the process over again. As opposed to beta oxidation, which is the process by which fat is converted into energy using oxygen. This also occurs in the mitochondria, the energy generators of every cell, and it's stimulated by epinephrine and ACTH. These fatty acids are broken into 2 carbon units that enter into the Krebs cycle. This all depends on the metabolic state of the cell. So the cell will choose whether it's going to go by the oxygen using, whether it's going to use sugar or carbohydrates or oxygen or fat with oxygen, or if it's going to use protein, all depending on the cellular milieu. But beta oxidation using fat, the reason why it's a better process, it can generate over 100 ATP per cycle, as opposed to the 2 that you saw just a minute ago. This is a way better, more efficient system. It's just not quite as fast. So a stressed cell may use the other system. You can see here the mitochondria, as I mentioned, over 129 net yield of ATP in this process. The fat is broken down into FAD, NAD, and it can make ATP. And now you get goes through the TCA cycle, and you make even more. So there's a good bit that you can make from using beta oxidation that the cell can make. So then mTOR and AMPK, these 2 have to be in balance. I want to encourage you to get away from thinking, oh, this is a good thing, oh, this is a bad thing, because everything is in balance. All of life is balanced. time that you spend at work, time that you spend at home, time that you spend with you, everything is balanced. If you spend too much time with your work, then you're not going to spend time with your family. If you spend too much time with your family, your business is going to fail. Everything is about balance. And so this is one of the balances. And I don't want you to think about either of these things being good or bad. They're just part of the balance that needs to happen. So what is AMPK? It is increased in skeletal muscle with thyroid hormone treatment and metformin use. It is a fuel sensing enzyme, and it's regulated by how much ATP. So if energy is that adenosine triphosphate, that ATP, if you're using those phosphates to create proteins or to whatever the cell's job is to do that particular day, then you're dropping these down from an adenosine triphosphate to an adenosine monophosphate or diphosphate. The more AMP or ADP that's present in the cell, the cell turns on AMPK. This is a fuel sensing enzyme. It regulates anabolic and catabolic processes to balance the energy for the cell. And during exercise, it's activated for this energy consuming process of exercise. It regulates sugar uptake and fat burning depending on the demands of the cell and what kind of exercise you're doing. And so this is how the cell determines what it needs and whether it needs to use sugar or fat or oxygen, what the circumstances are. In response to binding this, the AMPK activation stimulates fatty acid oxidation, production of ketones, and stimulates particularly skeletal muscle to do fatty acid oxidation and increase glucose uptake. It also inhibits synthesis of cholesterol, inhibits synthesis of fat droplets in the cell, and triglycerides. It also, in fat cells, not only in muscle cell, but also in fat cell, will inhibit the synthesis of fat deposits and inhibits breakdown of fats in the fat cells. It also modulates insulin secretion by the pancreatic beta cells. So this is how the cell determines what food source it needs during exercise. You and I might use a goop, or we might use a ketone ester before we do some sort of exercise. We might take a protein drink. We might go into it fasting on purpose. But this is how the cell decides what it's going to do in response to the environment it finds itself in. AMP is required for PGC1 alpha expression. This is the regulator for mitochondrial biogenesis. So every cell can have more than just one mitochondria or energy generator. If AMPK is turned on, PGC1 alpha is also going to be turned on, and now you're going to see an increased number of mitochondria per cell. We want to see that in skeletal muscle. We want to see it in nerve cells, so that for example, so you can continue to grow long dendrites in your brain and your nerve cells of your brain. Then mTOR, which is the balance of the yin and yang sort of AMPK, is the mammalian target of rapamycin, also referred to as mechanistic target of rapamycin. There are two complexes. They regulate different cellular processes. mTOR complex 1 regulates cell growth, cell proliferation, cell motility, cell survival, protein synthesis, autophagy, or the process of slowing down and taking note and fixing things. And then also it regulates transcription, which is the producing of proteins from the nucleus and from the DNA. It is a nutrient energy sensor, just like the AMPK is, and it controls primarily protein synthesis. It's regulated by rapamycin, insulin, growth factors, phosphatidic acid, leucine, and beta-hydroxymethylbutyric acid, which is butyrate. Mechanical stimuli and oxidative stress, which is that high level of reactive oxygen species, we'll see in the face of mitochondrial dysfunction. Decreased TOR activity increases lifespan in these worm and dust mite. Drosophilus is a fly, and it increases their lifespan when we decrease mTOR activity. So mTOR is when you exercise or lift weights and you go to have a meal after you exercise because you want to increase the size of your muscles, that's mTOR kicking in, going, all right, we've worked really hard, and now we're going to take in a big meal. So if you're going to have Thanksgiving dinner, do 15 push-ups before you go have your Thanksgiving dinner. That way you'll get muscle enlargement because of the mTOR building process. Think of mTOR as your builder. So while high mTOR signaling is good in early life, it's also inappropriately high it can be maintained inappropriately high in old age. And then calorie restriction and methionine restriction may act partly by limiting amino acids, which are potent activators of mTOR. And so we think there may be a part of calorie restriction and methionine restriction, which work through that secondary method of limiting mTOR activity. Overactivation of mTOR signaling can contribute to tumors and Alzheimer's disease. As you can imagine, if you had unrestrained growth, you might develop tumors. That would make sense. This is also during lysosomal storage. So when your cells are trying to produce proteins to send out to the environment around them, they package them in lysosomes in order to ship them out. And so mTOR inhibition of mTOR can help activate that process of getting rid of proteins, getting rid of unfolded or misfolded or trash. I say taking out the trash. mTOR inhibition can activate that process and remove those damaged lysosomes. So now we have better functioning cells, not so much trash in the room. Not to scare you, but this is the process, all the process that happen. And I keep this slide around all the time. So whenever I'm listening to lectures about these subjects, I'm referring back to this every time. So keep this in your back pocket on your cell phone, take a screenshot, because this is something, there's so much detail here. But if you look in the middle, you can see this is where that mTOR C1 is, and this is where AMPK, I know they put it in gray because this is a slide about mTOR. But this is this, and if you look how mTOR works, it's involved in metabolism, autophagy, that's that putting things away, organizing, this microtubule organization. It's involved in protein synthesis, how the cell creates proteins for use. It's involved in lipid synthesis. And when you engage mTOR, then you begin to get PGC1 alpha and then mitochondrial biogenesis. So you can increase your production of energy producers. So now all these guys can be working towards making energy for your cell. I know that's a complicated slide, but keep that around because you'll be able to refer back to that anytime someone says, oh, I used ERK one half. Well, it's right here on the slide. And you can say, oh, I see how that's all related. So the cell continues to decline in efficiency. The brain and the intestinal cells begin to be unable to make neurotransmitters because making neurotransmitters requires NAD+. This limits the hypoglycemic effect of serotonin on the pancreas. The pancreas begins to get overwhelmed with the high glycemic environment that it's involved with. Mitochondrial dysfunction occurs, increased reactive oxygen species because the mitochondria are not functioning optimally. Now the cell is under oxidative stress, and this regulates gene transcription and histone acetylation. So the histones are, I'll talk about that in a minute when we talk about SIRT1, but the histones are the spools around which DNA is wrapped. And so this oxidative stress process begins to affect the way the cell can do its job and how effective and efficient it is at doing that. The expression of these SIRT genes that are involved in this, the DNA wrapping around histones, now because the cell's under stress, it begins to be decreased in its ability to produce SIRT1. Apoptosis, which is this controlled, organized process that the cell could be going through, is no longer an option. Apoptosis is the, I'm moving from my house and I have the option to pack everything up neatly, put it in boxes and take it to the next house, put it on a truck and take it to the next house. I alternately could use pyroptosis, as if I'm the cell, I can use pyroptosis, which is, if you know the word pyroptosis, you know the Latin derivative, it's fire. And so you could explode your house, which is what sometimes happens to cells under this degree of stress. And the third option is for the cell to begin to become a senescent cell. This is a unique characteristic, and it has its own unique profile. It looks different than regular cells. And we know that senescence affects tissue-specific stem cells. I heard someone say a few weeks ago that we don't have any stem cells in our bodies, and that's just not true. So every single cell, every single tissue of your body has stem cells around for repair, this fibroblasts. This oxidative stress is too many reactive oxygen species. The cell is no longer able to produce enough balancing antioxidants like glutathione, and this imbalance leads to damage to cell walls and DNA. The cell is trying to take fat from the cell wall to use it for energy production. It's not effective. We end up taking the wrong pieces and getting ceramides involved. It also interrupts the normal cellular signaling, so the ability of the cell to signal other cells around it or your immune system. So let's say it's an infected cell. The cell that's under this stress is unable to signal the immune system to come along and take care of the cell. The immune system also will use, so let's say we're talking, if this cell we're talking about is an immune cell, like a macrophage or an astrocyte, we know that those immune cells will use reactive oxygen species to kill pathogens. So there's a purpose for the oxidative stress in some situations. And in short term, there's the oxidative stress is purposeful. In the long term, we end up having more trouble with mitochondrial dysfunction, as I mentioned before, and then difficulty with stress resistance and resilience of the cell. Okay. So more about senescence. This is a response of the cell, which is aiming to prevent the propagation of damaged or diseased cells. It is beneficial in an anti-tumor response. It's also beneficial, it's used in the embryo state to help divide your fingers from one another. So we start out with skin in between our fingers, of course, and senescence comes along to remove that skin between so that you don't have webbed fingers. So there's a positive, again, as I mentioned before, senescence isn't a bad thing in all situations, and acutely, it's very beneficial. So think about if you have a wound, the senescent cells go to the edge of that wound to prevent fibrosis from being present, to allow that wound to heal without so much scarring. But as we age, this contributes to the loss of function of the cells, of the tissues themselves. It's triggered by oxidative stress. It can also be triggered by chemotherapy or radiation, by impaired autophagy, and by mitochondrial dysfunction. These things will activate the DNA damage response. Once there's enough damage to the DNA, this will activate the DNA damage response, which turns on P53. P53 is involved in arresting cell cycle. So the cell goes through its growth cycle and then divides. And in the face of this much oxidative stress and the DNA damage response, we now have activation of P53, arrest of the growth cycle. And uniquely with senescent cells, unlike with the pack up and send my stuff to the other house or the bomb off on your house, this option still functions as a house, but it's like a haunted house. Senescent cells remain metabolically active. So there's kids going to the haunted house all night long. It affects stem cells around it in proximity. And the problem with that is now you no longer have a quiescent stem cell to do the repair job that you need done. You have these stem cells also being converted to these senescent cells. And I'll show you why that's not helpful. Again, permanent cell cycle arrest. These cells, now that they're in arrest, they remain biologically active. And this whole thing evolved as a beneficial response, but here we are in the case of aging and disease, and these cells begin to accumulate over time. They have this very unique senescence-associated secretory phenotype. This is, what does the cell look like? You know, your phenotype is hair color, eye color. These particular cells have unique phenotypes. And we know, depending on the tissue where the senescent cells are found, we know that they have their own unique panel of chemical factors that they secrete. So these pro-inflammatory chemical signaling molecules are unique to each type of senescent tissue, senescent cell in the tissue. This is dependent on that nuclear factor kappa beta translocation into the nucleus to begin that process of pro-inflammatory chemical production from the DNA. And it's also dependent on activation of mTOR. So positive things about mTOR if you're a bodybuilder, or if you are a sarcopenic elderly patient, but not if you are trying to keep your pancreas from developing diabetes. These cells not only secrete a unique panel of pro-inflammatory chemicals, but they also are resistant to that apoptotic cell death, which is the packing things up and shipping them off to the next house. So the cells do not go through this very organized process. They shift from using fat burning with oxygen, as I mentioned before, which generates 100 plus ATP per cycle, and they begin to use this inefficient but quick sugar without oxygen process that produces two, but it's way more work. And now you begin to get more dysfunctional mitochondria because they're creating more reactive oxygen species. So the process just propagates itself. This is associated with the common diseases of aging, like wrinkles, loss of muscle mass, etc. These cells also have an unusual shape, and they have this increased unfolded protein response. So now the DNA transcription from the nucleus is no longer this very efficient, organized system. Things aren't in place like they need to be. And so proteins are coming out of this very disorganized nucleus that don't really fit their keyholes where they're supposed to fit. They're not exactly the right shape or size or length. And so they begin to clog up all the systems, the endoplasmic reticulum and the lysosomes. They begin to clog up all the systems. And now you've created this additional problem. So this is where we get some of our common familiar unfolded proteins like amyloid beta. You get this excess lysosomal activity, as I mentioned, with the unusual unfolded protein response. Now these cells produce a protein called beta-galactosidase, which is related to excess lysosomal activity. So you'll see this occasionally in excess beta-galactosidase in other inflammatory states. So it's not unique to senescence, but it is one of the things we look for when we're trying to decide how many senescent cells are present. Again, these cells have paracrine effects on stem cells nearby. And there's tons of references. So again, lots of factors can contribute to this happening: epigenetic factors, telomere erosion, DNA damage, and this is stem cell exhaustion and chronic inflammation are what we end up having. And so you get decreased organization of your mitochondria, and the cell falls apart and becomes this evil haunted house. Stable growth arrest, the phenotypic alterations that I mentioned with the unusual or unique to each tissue, but pro-inflammatory regardless. Osteoarthritis is involved with this. If you go to Google Scholar and you look up any disease state, senescence and blah, 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 senescence and whatever your disease state is, you're going to find article after article after article showing the relation between this process that I've just described to you and the process of disease. And if we can get rid of disease, we can get rid of aging and improve our quality of life, at least, if not length of life, ideally. This growth arrest is implemented by the activation of, I like to call it pink because it's P16INK4ARB. Yeah, let's call it pink. And again, P53, as I mentioned before. And so you look again at all these things that can cause the problems. You get the DNA damage response because of the damage to DNA caused by all of these things. Now you get activation of P53, activation of pink, and now the cell goes through this senescence process. I love Dr. Smith-Fernandez's analogy that she mentioned the other day about the employee at the office that ends up being sort of a cancer in your office, and he talks to the other people that they're sitting next to and complains about the boss and complains about the management, and all of a sudden all of your employees hate you and think you're a terrible boss. And I can certainly relate to having, I'm sure many of you can, to the difficulties with finding good help. And so that makes a really good, it's a great analogy for me. So these stem cells are part of the process that our body heals as we have damage or injury or whatever. And so the stem cell exhaustion can also occur with age, regardless of senescence. So they are more susceptible to senescent cells around them with age. Their capacity of renewal is decreased, and you have a more difficult time. So if you've ever done stem cell or PRP or autologous fat injections into these patients, fat stem cells into these patients, into their knees or joints, whatever, the older the patient is, the more senescent cells the patient has, the less likely they are to have a great outcome from doing one of these transplant procedures. And so we know that if you transplant the cells from elderly patients, they don't do as well. Neural stem cells are the same way. Think about the brain, think about neurodegenerative disease, and they have a limited ability to generate new nerves to grow with age. It's one of the reasons why we encourage elderly patients to find a new hobby, learn a new language, learn a new instrument to play. Again, these are the senescent cells, and you can see these increased reactive oxygen species in the cell, these little bombs that you see going off that are influencing everything around them. P53 gets activated, the cell slows down. Now we get the cell doing poorly, having a rough time getting anything accomplished except for spewing inflammatory messengers like Henny Penny would do. More information, the same idea. The good side of senescence is tumor suppression, because if you think about if a senescent cell is part of a pre-cancer or a cancer, if you have senescence take over that, now the cell is unable to replicate. So even though it may be secreting some inflammatory factors, it's not able to replicate. So it's a great method for tumor suppression. It prevents fibrosis at the leading edge of any sort of trauma, including heart attacks, strokes. There are senescent cells at that edge, and we want those senescent cells to be present. Normal development, as I mentioned, with the finger separation, many other things, of course. But it is involved in aging, chronic inflammation, and cell and cancer promotion. This is more places where you might see senescent cells take place. Glaucoma, as I mentioned, go to Google Scholar. Glaucoma is a process. Idiopathic pulmonary fibrosis is a process. Liver, kidneys, pancreas, weight loss, sarcopenia, and osteoarthritis. The list goes on and on of places that are affected by senescence with aging. Again, the driving factors, all of these things: DNA damage, reactive oxygen species, the unfolded protein response. Now we're getting these inappropriate proteins. Here's the pink and the P53 involved. You get growth factors and cytokines that are inflammatory produced. Now you have a joint that's inflamed, or diabetes developing, or the beginnings of dementia in these patients. Loss of resilience. These often precede the onset of chronic diseases and primarily geriatric syndromes like frailty. This is the aging process itself, which is a chronic, sterile, low-grade inflammation. It also affects the stem cells. It also affects the development of cellular senescence. And so the senescence is involved in these age-related phenotypes as well as in good things. These accumulate in fat tissue in diabetics as well as in morbidly obese patients. You'll see quite an accumulation of senescent cells in obese patients. The aorta in vascular hyperactivity, atherosclerosis, etc. And if you take a mouse and you transplant senescent cells into the knee joint, actually just around the knee joint, they can stimulate the production of osteoarthritis in just a few weeks. If we can eliminate senescent cells, and again, this is with these mice, if you can eliminate senescent cells, you can actually reduce inflammation in many tissues. And so IL-1 alpha, IL-6 tumor necrosis factor alpha, nuclear factor kappa beta, we've talked about these before. Refer back to your slide with all the arrows going everywhere. And all these inflammatory factors are increased with aging and phenotypes such as frailty. So this accumulated damage, the lifelong antigenic load, so you're exposed to dust mites and dogs and dairy and all the things that we might have that are antigenic to ourselves. Now we begin this process called inflammaging. And I think of it like the bathtub with the overflow valve. And as you age, you begin to accumulate all of these things. And now when you get to the top, it sort of begins to overflow. And now you see them on your skin surface. You see them in your hair texture, you feel it in your heart, you see that anybody over 40 is going to know, you see it with your joints that don't heal, your tendons don't heal as quickly after your injury, after you do something minor. I heard a comedian talk about how he used to injure himself doing something heavy, lifting something. Now he just injures himself waking up in the morning. So anyway, this is usually involved, as the damage accumulates, it's usually resolved by clearance by the immune system, but unfortunately in aged people, in individuals, the senescence also affects their immune system. So not only their thymus gland is affected by this senescent cells, all their macrophages and all their inflammatory cells, B and T cells, are affected. So you get this immunosenescence, and now you can't clear the senescent cells in each tissue, the liver, the kidney, the pancreas, like you used to be able to, or the brain, and that's where disease begins.